Ooh, ah.
Hello everyone, it's Ryan Liberty, and welcome back to the series on trauma and PTSD, everything that you need to know. In this section, we're going to talk about how PTSD and trauma affect your body, and they affect your body in many different complicated ways. Often, they affect your brain and the way that your brain interacts with your body, and although this is a complicated process, we'll be talking about it in very general terms here. Please note that although everything in this section is based on research often comes to conflicting conclusions about what's going on, and research is always ongoing. Also, since we'll be talking about a number of changes that may be happening in your body, please be aware that these are not always permanent changes. Very often, treatment of PTSD and trauma starts to reverse the changes that we see. In this section, we're going to talk about the changes in your body in areas like your amygdala, your ventromedial prefrontal cortex, the different levels of cortisol in your body, your hippocampus, your thalamus, your Broca's area, and the default mode network. Amygdala. The amygdala is an area of your brain that responds to threats, and it readies your body for the fight, flight, or freeze response. After trauma, your amygdala becomes hyperactive, so you see it preparing for those threats more often. This may explain the symptoms in trauma and PTSD of hypervigilance and an exaggerated startle response. Ventromedial prefrontal cortex. The ventromedial prefrontal cortex is an area of the brain that regulates the amygdala and the emotional response to fear. It's also known as the executive functioning or the thinking brain for its role in making decisions. After trauma, the ventromedial prefrontal cortex shrinks in volume, and this may explain why people who've been through trauma have a hard time calming down after arousal and find themselves with a persistent negative emotional state. Cortisol. Cortisol is secreted in response to stress and plays a key role in activating the fight, flight, or freeze response. After trauma, the system that cortisol is involved in gets dysregulated and has different effects for different people. Some people may find themselves often over-aroused and having anxious symptoms. Other people may find themselves under-aroused and having more depressive symptoms, while others may find themselves with a mixture of the two. Hippocampus. The hippocampus is an area of the brain that is important in forming new memories. After trauma, the volume of the hippocampus shrinks. If the trauma occurs in childhood and the hippocampus shrinks, it also makes somebody susceptible to trauma further on in life. This is because after the hippocampus shrinks, it may affect our ability to categorize new experiences. The shrinking of the hippocampus may also explain why we have a hard time distinguishing flashbacks of memories that occurred in the past with sensations that we're experiencing now, today, in the present. Thalamus. Our thalamus is an area of the brain that is responsible for integrating our sensory input. In other words, it takes the information from our physical experience and puts it together into a comprehensive whole. After trauma and PTSD, the activity in the thalamus is shown to have been decreased. This may explain why we're susceptible to flashbacks and why our memories become fragmented and we respond to specific fragments of memories, also known as triggers. Broca's area. Broca's area is known as the speech center of your brain. After trauma, there's decreased activity in Broca's area. This may explain why we often have difficulty explaining what our experience is like after we've experienced a traumatic event, and it may also explain a limitation in talk therapy of being able to treat people who've been through trauma. It may also point to why we have distorted cognitions, distorted thinking about what occurred during our traumatic experience. Default mode network. The default mode network is a set of regions in the brain that is active when we are not engaged in a specific task. It has a lot of different responsibilities, and those include things like autobiographical information and emotional experience, thinking about others and how they're feeling, and processing stories in time. In people who've been through trauma, the default mode network shows lower activation levels. This may explain some of the anhedonic symptoms of trauma and feelings of detachment. The body after trauma. After trauma and PTSD, your body is affected in a number of different ways, often in complex interactions between your brain and the rest of your body. Some of the areas affected include your amygdala, your ventromedial prefrontal cortex, the levels of cortisol in your body, your hippocampus, your thalamus, your Broca's area, and the default mode network. Although everything in this section has been based on research also shows a lot of different conclusions that conflict with each other. So please be aware of that, and remember that research is always ongoing. Also, although we've talked about a lot of changes that may occur, these changes can be reversed with treatment of PTSD and trauma. If you have an experience with any of these areas that we've talked about, or if you have any questions about the way that PTSD and trauma affect your body, please leave your experience for the community. And if you're enjoying this series on everything that you need to know about trauma, please subscribe.